Hi, and welcome to this week's In Focus on WGTV Channel 11. Thank you very much for joining us for this conversation. Yes, this was supposed to be an In Focus candidate forum, but last week, as well as this week, neither of the candidates who were running in the contested race that we were scheduled to speak with were able to join us this evening. But we do have a guest that we will talk to from the Wayne County Health Department. That'll be coming up in just a couple of minutes. Do want to take a couple of minutes and update you on what's going on in terms of election. There is still a very important election going on, and we do have another candidate forum scheduled for next week where we know at least one of the candidates in this contested race will come join us, and it is an important race. Our current congressman, Congressman Greg Pence, is not running for re-election, so there will be a new person representing us at the first of the year in the 6th Congressional District. There are 3 candidates running for that race, and we will have a chance again next week to speak to at least one. We have invited all 3 of them to join us for an In Focus candidate forum next Thursday evening live at 6 p.m. on WGTV Channel 11. You can also see it streaming on our Facebook page. It will also be available on WGTV online, which is our Vibit, which is always streaming 24 hours a day, 7 days a week, 365 days a year. If you do not have Comcast cable and you want to see what WCTV, WGTV, WETV are showing, WETV or WGTV, we do not stream WCTV, are showing, you can always go to WGTV.vibit.com. That's WGTV.viebit.com, and you can always watch us 24 hours a day. Next week, again, mentioned U.S. Representative District 6. Voting has already begun in our area, so you can still do that. Voting in person, you need to have a government-issued photo ID to be eligible to vote. You can do it in the Wayne County Courthouse on the 2nd floor, the voter registration office, 301 East Main Street. That's happening. It started October 8th and will run through November 1st. Your times for that are Mondays from 8:30 until 5. Tuesday through Friday, 8:30 to 4:30. On Monday, November 4th, just the day before Election Day, you can also vote there in person from 8:30 until noon. And it will also be open on 2 Saturdays, October 26th and November 2nd from 9 to 4. If you need more information, you can call the voter registration office, 973-9304. And if you are not registered to vote, it is too late. You'll just have to register to vote for the next election. I also want to remind you that in-person absentee voting, sometimes called early voting with the vote centers that we have been doing for a number of years, those are going to open on October 28th. Those will be open from October 28th to November 1st, 10 a.m. to 7 p.m. There are 4 locations: the First Bank Coleman Center on Salisbury Road, Golay Center in Cambridge City, First English Lutheran Church at 2727 East Main Street in Richmond, and Hagerstown New Testament Church. Those locations are open October 28th through November 1st from 10 a.m. to 7 p.m. The First Bank Coleman Center will also be open on 2 Saturdays for voting, 10 a.m. to 3 p.m. That's Saturday, October 26th, and Saturday, November 2nd. And then, of course, Tuesday, November 5th, Election Day, 6 a.m. to 6 p.m. There will be even more locations to vote, along with the 4 locations that we had previously: First Bank Coleman Center, First English Lutheran Church, Golay Center, and Hagerstown New Testament Church. On Election Day, Mount Olive Baptist Church at 1108 North H Street will be open. A Life Spring North Church, 5600 US 27 North, First Baptist Church, 1601 South A Street, and Centerville Christian Church Family Center at 106 East Main in Centerville. Those 8 locations will be open from 6 a.m. to 6 p.m. on November 5th. And then we invite you to join us that evening, Tuesday, November 5th, beginning at 6 p.m. for a live election night special, which will originate from the lobby of Whitewater Hall here on the Indiana University East Campus. So plenty of dates, times for you to register to vote. As I mentioned, this is a very important general election. There are 3 contested school board races in our area, in Hagerstown, in northeastern Wayne School District as well as in the Western Wayne School District. We also have the race for a 6th congressional district, and then of course you've got a governor's race and other state races as well as some of the presidential and federal races. All of those are taking place, so we encourage you, if you are registered, to show up and vote. Now let's turn to our guest who has been sitting patiently this evening with us. I have a chance to speak to Dan Burk, who is the director of the Wayne County Health Department. We have not had a chance to speak with the health department in quite a bit of time. Dan, thank you very much for taking time and coming to talk with us.
Glad to be here.
Talk to me a little bit about your background, how long you have been employed with the county, how long you have been with the public health, with the health department, and what brought you to public health?
So I was born and raised here in Wayne County. After high school, did a few jobs, and 3 months after my 21st birthday, I was hired by the Wayne County Sheriff's Office for the jail division. That was in January of 2000, and I was there up until 2015, and I decided to take a different direction in my career path. And there was a job available at the county health department, and that was perfect because I get to transition my retirement, my time off, so I applied for the position. And it fit my skill set. I was able to read and interpret code, and my job at the time was inspecting housing. So any housing complaints we had, food inspections. So I was able to take those inspections and fit them with the code because I had that ability to read and interpret code. And I've been there ever since, so approximately 9 years, and transitioned into several different positions over those 9 years.
What about the health department has kept you there? You mentioned transitioning into different positions. What are some of those positions, and what did you learn from doing that? What have you learned being in the health department?
My goodness, I've learned a lot of things. So a lot of people don't realize what the health department does, and I was one of those people before I was hired. So I started off as a food inspector and housing inspector, and then I slowly transitioned into septic inspections, emergency preparedness. I helped a lot with the clinical side, setting up different flu clinics and things like that. On the emergency preparedness side of the health department, we're in charge of emergencies. So for instance, during COVID, when it broke out in 2020, my job was to organize all the vaccination clinics, to coordinate with the school systems, daycare systems. All the meetings involved myself and the director at the time. So every clinic that we held in Elder Bimron, I was in charge of orchestrating that and getting the volunteers and keeping track of them and things like that. Then as COVID started to slow down, there were still things going on outside of COVID that our director had to focus on. And at that time, she was the only one in charge. So I kind of took on a supervisory role without actually technically having the title over the environmental side, and I was able to help that department stay in track with code and policies and drafting policies. And then in 2023-24, they created a deputy director's position over the environmental side, and that's what I filled the role of. And then soon after, we transitioned again, and we lost our deputy director of clinical services, and we didn't have a director at the time as well. It was just myself. So they opened the position up, and I applied for it, and then was voted in as the new director last month.
What made you want to step into that role?
I wanted the environment to be easy to come into. And I think bringing in a new person at that point to fill in a director's position would put the staff in an uneasy position, the unknown. They knew what they were getting with me. So I felt that if I stepped into the position, I could transition the staff well. I could, they would feel comfortable. They could train me because I'm not a clinical person. And I had experience when I was with the Sheriff's Department. I kept a supervisory role from 2005 up until the time I left in 2015. And during that time, under the two different administrations, I went through several trainings, for that particular role. So I had the skill set in the administration and supervising people, scheduling, talking to people using verbal judo, things of that nature. So I felt if I didn't apply, I didn't know what I was going to get. So I wanted to take that leap of faith, and luckily they voted me in. So.
You said you've learned a lot in terms of the health department, and you think there's a lot of people who don't understand all that the health department encompasses. You also mentioned not being a clinical person. Talk a little bit about, if you can, the divisions in the health department so that people somewhat understand a little bit more all of the areas that you all touch.
Okay. We touch a lot. So when I first hired in, I thought the health department only handled food and housing. We did food inspections. We used to read them in the paper all the time, and that's what we were known for.
Yep.
So that's what the general public believes we're known for. On the environmental side, the environmental side does several other things. We do food inspections. We do housing inspections for unsanitary conditions. We investigate homes with children that have elevated blood lead levels. We have to investigate those. We do animal bite reports. We do septic inspections. We inspect all public and semi-public pools and spas. We handle vector control. We handle a lot over there. And then we also assist clinical staff if there's an emergency such as COVID. You know, we at that time during COVID, our environmental staff was over registering patients for vaccines and things like that. So that's what we do on that side. There's three divisions. So you had the environmental, what I just discussed, and now we have the clinical side. And clinical side covers several other things. Some of those things I'm still unaware of, I'm still learning, but obviously we cover vaccines. We cover testing for infectious disease, so including HIV, hepatitis, and sexually transmitted diseases. We do outreach programs. We hold vaccine clinics on and off site. We do TB investigations, tuberculosis investigations. We have a program that is called FEMUR, and it's Fetal Infant Mortality Review. So they review all deaths in Wayne County, and 6 counties actually, we're jurisdictional, regional. And we try to determine why infants or fetuses are passing away before birth or soon after birth, and then we try to target those down. And then on the flip side of that, we try to create programs to prevent that, whether it's prenatal, safe sleep, things of that nature. So we have that program over there. Let's see. That's about it. There's a lot, like I said, there's a lot of subsections to the clinical side. On the third sector of the health department, we have vital records. And vital records is birth and death certificates, paternity affidavits, burial transit permits. They also act as our hub for all phone calls. So most of the phone calls go into those two ladies. Give them credit, they handle it well. And then they transfer it out to whoever they need to transfer it out to. So that's a short view, and like I said, I'm still learning.
There's a lot under that roof.
There is. Yeah.
You mentioned winding down from COVID. Talk about where the hell, because obviously you all were all in it for those years. Right. It is beginning to back out a little bit, but talk about where the community is in terms of COVID right now. It's obviously still out there. I'm still hearing about people that are getting it.
Right. So I just looked at that yesterday. I had a health board meeting yesterday, and they asked me the same question. And when you look at our numbers, they're low. And there's a couple factors in that. It's out there, most definitely. People test positive daily. But people test at home, so therefore the numbers aren't reported, or they don't test at all. And then the other part of that is there's a program that State Department of Health has teamed up with our sanitary district here in Wayne County, and they test the wastewater for COVID. And so we have those numbers, and that's a better comparison. So as of right now, our numbers are low for Wayne County. We're trending down. We had a little spike 3 or 4 weeks ago, and we're starting to trend down right now.
Okay. In terms of the clinical side, it's fall. We hear about flu shots, obviously. I think there's a new COVID booster, but help me out with that, that some people need to get. As people get older, I just had a milestone birthday, as it were, and people go, well, now you need to be thinking about the pneumococcal virus and things of that nature. Talk about how you all handle that and what you all help people with.
Okay. So we provide essentially any vaccine that's out there that needs to be administered. When it comes to flu and COVID, we hold clinics, and we also have daily operations. For childhood vaccines, we also hold clinics, and it's school-age vaccines. We hold clinics at schools. So there is a booster for COVID, and we always, when it comes to any vaccine, unless it's already mandated by law for school-age children, we ask that that person at least consult with their primary care physician and let them know, and then they can come to us and we'll administer the vaccine. But we'll administer anything that they want us to administer as long as it's within the regulations of the law.
People need to make reservations or make an appointment to come by. You to accept walk-ins for some of these.
Yeah. So as of right now, we are a walk-in and appointment. As we start to hire people and restructure things just a touch, some of that may change, but as of right now, we are a walk-in clinic and appointment.
Okay. We're speaking with Dan Burk, who is the director of the Wayne County Health Department, spending some time talking about the health department itself, what it does, where it's going at this point, and let's kind of get into a little bit of that. You mentioned as we hire some people, obviously before this conversation I had a chance to kind of look at your website. There are some vacancies that you have. And just through watching some of the meetings, we know that Dr. Jetmore may be stepping away from the health officer position. Can you talk about some of the positions that you have open on your staff? And are you hiring now, or are those after the first of the year when the new budget kicks in?
Okay. So we'll start at the top. So we'll go with Dr. Jetmore. Dr. Jetmore is wanting to retire, so he's wanting to step down from the health officer role.
He's not wanting to travel more.
Yes, he's wanting to travel more, and he's done a great job, especially during COVID. He got put through the ringer during COVID. That's not typical for a health officer, so he definitely deserves it. So in that, our health board president and health board's been recruiting new potential health officers. And with that said, Dr. Jennifer Bells, an emergency room doctor at Reed Hospital, has agreed to take on that position, and we're working out the logistics right now as far as contracts and malpractice insurance and things like that. But she's going to onboard, hopefully, if everything goes to plan with attorneys and contracts and stuff, hopefully on October 28th. But that's a loose date depending on the other factors. Stepping down from that position, we go to our physician assistant to a nurse practitioner. So we had a physician assistant, his contract ended and we started to go a different direction, so we're looking for a physician assistant or nurse practitioner. They're interchangeable for what we need at the health department as far as the titles go. For that position, we are more comfortable as a county to use a contractual service instead of doing independent contracting with individuals. So that's another contract I'm working on. Is a company out of Indianapolis called Vergence, and they are essentially the manpower of medical field. So I will use that company once this contract is completed by the attorneys. We're still working on that as well, to hire a nurse practitioner or physician assistants to fill that role. And we've been in talks with a couple local candidates, and those people will then apply through Vergence, and then we'll tell Vergence we want that person hired, and they'll come back to the county. And then we just pay Vergence the contract fees at that point. And then we come down from there, and county council and commissioners graciously approved 3 more medical assistants for me to come out of the budget that we do not have to contract. They will come out of the Health First Indiana budget, and I have filled those 3 positions at this point in time. So Gennaro Sparks, he was an independent contractor before. We was able to onboard him as a county employee, and then we filled the other 2 positions with applicants. So they're in the process of training right now and hope to be fully trained within the next 2 to 3 weeks to start doing their duties. They are broke down into subsections. So Gennaro is our outreach coordinator. He does all outreach programming. So he sets up at different events and advertises or markets the health department, provides testing. We have an MOU, a memorandum of understanding with Ball State University, so we go over there once a month and we test all the students. We do several things like that. And then as far as outreach goes too, he sets up clinics for vaccinations and everything like that. So just on that, with that being said, in the last month we've done Vail School, Star School, Northeastern School, Astro Plaza Clinic, Golay Center Clinic, Willows Nursing Home, Vaccine Education at Safety Village, Earlham Vaccine Clinic for the students, Fairview School, Earlham for staff and students, and we just done another nursing home today.
And you're shorthanded.
And we're shorthanded. So the staff has really stepped up and helped out. And these were all, the schools were school-age vaccines that are required by law, and flu or COVID if the parents so wanted.
Okay.
And the nursing homes are typically flu and COVID. So Gennaro's done a great job with that. Wendy Whitlow is another medical assistant that we hired, and she is assigned her to be school liaison. So she will coordinate with all 22 schools in Wayne County. I believe there's 22 schools in all the systems.
Okay.
And she will pair with their school nurses, and they will develop programs, or we will help them with the needs that they need as far as the medical end of the school programming goes. And then Sarah Gerton is the other MA that we hired, and she will be part of our harm reduction team. So they will be part of the testing when it comes to HIV and Hep C, and also run the syringe exchange program. So those are those three positions.
You've mentioned the word outreach 4 or 5 times during this conversation. Obviously, you talked about some of that, but what does that look like for you all, and how far ahead planned are you? You obviously, a couple of years ago, 2, maybe 3, I'm a little bit lost, got the big health department van that you all are able to take
Correct.
out. How much has that helped you all? Where have you all been able to go? Are there places in the county where that van goes on a regular basis, or is it kind of hit and miss?
No, there are scheduled. As we get closer to winter, the van kind of goes out of commission because we have to winterize it. You know, we're not able to use the water and the restroom facility in it. But during the operating months, it is definitely used. We hold an off-site clinic every month. One time a month, we hold one at Hagerstown. And we're not able to use, we could use it there, but the trustee lets us use his office. So we go in there and we perform that clinic in there. And then on another Wednesday during the month, we go to Golay Center and we set up in their parking lot. So therefore, we do utilize the van in that one. We used to set up in Fountain City. We use it for the fairs or any community events, whether it's Elstro Park or out at the park, City Fit, things like that. Some of the school events we have used it, and then some of them were set up like a fair function, so we can't park it there and take up all the room. So we set up tents and things like that for those type of events. But we do utilize the mobile clinic, as we call it, or mobile RV, or there's several different names for it. But it is utilized, and unfortunately, I only have a few people that can drive that large thing. So one of them being me.
What are the type of things that you all are able to do out of that van that has made it useful for the department?
So we can vaccinate. If necessary, we could perform phlebotomy, so we can draw blood if necessary. We have refrigeration units in there to store vaccines and medications. We can do consultations in those. There's 2 different exam rooms with their own independent door. There's a little couch and a TV in the waiting room, if that's what you want to call it. It's so small. And then there's a restroom in there for different testing if we had to do drug screening or anything like that.
Nice. You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending time with Dan Burk, Director of the Wayne County Health Department. Appreciate the time that you're giving us today. You mentioned Health First Indiana funding. I know this is budget time for the county. We want to talk about some of the priorities for that, but talk about this Health First Indiana funding. What is it, and what does it allow you all to do?
Okay. So Health First Indiana funding was, there was first a commission that was set up through the state. Governor Holcomb ordered that commission to be set up. And the commission deemed what Indiana was worse at, basically, in the health realm. And then they took those numbers and developed programs, and you need money to fund programs. So with that, they set out a number of what they call key performance indicators, and I believe there's 26 of them. Don't hold me to that, but I believe there's 26. And they take the money over the 2-year budget period, the state, and they issue that to every county in Indiana that opts in. It's not mandatory, but all 92 counties did end up opting in this year. Okay. And they base the money that they give that county by the metrics and size of that particular county. And then with that funding provided, we can create several different programs. So the 3 MAs I just spoke of, they're funded out of Health First Indiana. And those 3 programs that they operate are able to operate due to that funding. And I have 6 different partnerships with outside partners, contracts. So we have partnerships with Reed Health, Neighborhood Health Clinic, Girls Inc. I'm sorry, not Girls Inc., Birth to 5, Purdue Extension, Drug Free Wayne County. I think I'm missing one there. But in each one of those, partners have put in their proposal and contract of how many of the KPIs or the key performance indicators that they will do for us. So essentially we're getting the money and we're outsourcing and letting them do some of the work for us, and then we report those numbers back to the state. That includes everything from maternal and child health to trauma and injury prevention, smoking cessation, obesity, high blood pressure, cholesterol, vaccination rates. There's several key factors there.
Were those key factors that you just mentioned, are they statewide, or were those particular to Wayne County and things that we were low in?
The worst at. So the state determined for Indiana as a whole,
Okay.
and then they broke it down into all 92 counties. So when I look at those numbers, I look at, let's say it's smoking cessation and the number of teenage kids that smoke in Wayne County. And I'm just going to throw a number out here. This number's not a correct number, but let's say it's 14% of Wayne County teenage children use tobacco. And then the state says, well, the state average is 15% or 12%. So that tells me where we stack up with the rest of the state and what we have to do, whether we're on that line, whether we're good, or whether we need to improve. And that's kind of how we pick which services we focus the most money and effort and staffing to.
Okay. So we have high obesity rates. We have high infant mortality rates still here in Wayne County. That was one of the things you mentioned, smoking cessation. Those things for us are still issues here in Wayne County.
Correct. So with that said, our partners are having smoking cessation programs. We have a partner that is providing education on healthy cooking and how to shop, and we have a partner that is providing safe travel for kids for the trauma and injury prevention part of it for bicycles. So there hopefully will be signage in the future for children to go, then issue bicycle helmets. We just partnered with Firefly and Richmond Police Department and was part of the car seat connection and was able to help them monetarily with money to purchase car seats and tags for Wayne County residents that showed up. And then my FEMA program coordinator was also at that event providing education on safe sleep and things of that nature.
I know one of the things that has been talked about a lot, and I think you even mentioned it, high levels of lead in children in this area. We have some older homes, obviously, in this area still. Instances of lead paint being used or at least coming off in buildings. How are we doing? At one point, we were having some serious issues with that number.
Yeah, so we still are. We get several cases a year when it comes to lead. Most of it is in the older part of Richmond. You know, homes after lead paint was essentially no longer legal after 1978. So anything prior to 78 is questionable. Anything after 78 could potentially have it, you know, if somebody had some leftover cans and stuff, but typically we focus on the homes prior to 1978. And in order for us to get involved, that child has to be 6 years of age or younger, and they have to test above a certain level, 3.5. If they're lower than that, then we can't get involved per statute. But let's say if a kid does test positive, then at that point I send the environmental side of the department out to do the physical assessment of the house, and that person has to be licensed by the state. We have to send them back for training every 2 years. They use equipment that essentially is a handheld x-ray machine, so we can hold it up against walls and we can determine how much lead is in those walls. We do ghost wipe samples, so they wipe a square foot section on every floor in the house, every wall in the house window sills, trims, everything. And then we send that all off to the state lab and they give us the numbers. And that allows us to then focus and turn around and tell the family or the property owner, this is where it is, this is how we remediate it. And that's where we run into some issues on the remediation. A lot of landlords don't like to repair, things like that. So we're working on that. So some policies and procedures, and hopefully down the road, hopefully some ordinance may be passed. And I know the public doesn't like to hear that word, but there's some instances where ordinances are necessary to protect the public, basically.
In terms of safety.
Safety, for children especially. And then on the other side of that, the clinical staff, our public health nurse, goes along with our environmental staff, and she does a health assessment with the family. So she does a verbal consultation with them, and she asks them, this child lives here, but does that child spend time at a daycare or a grandmother's house or somewhere else? And we may have to end up going there, and that house may be the problem, not the house of the residents. We also ask, where the family's employed, if they're working for a metal manufacturer or something like that they could be bringing something home. Mm-hmm. So it's not always the house. It could be other things. We had cases where children were eating batteries, and the parents didn't know. So that's lead tile around fireplaces. A lot of dinnerware from Mexico has lead in it. Anything with high vibrant colors is stuff to watch out for.
It sounds like what you all would prefer to do is do education. Correct. For the community as much as possible. Am I reading that wrong?
No, you're exactly right. I'd rather educate than enforce. That is our goal as a health department, is to educate instead of enforcement. We'd rather educate that property owner or that family and have them corrected on their own than us have to come in and use statutes and the law to get it corrected. So we are an education agency. That's what I like to think of us as. So.
Cool. We're talking with Dan Burk, Director of the Wayne County Health Department. We're going to take a break, come back, find out a little bit more about the health department and maybe some things that you don't know or need to know as we continue with In Focus on WGTV Channel 11.
There's nothing like a beautiful day and an early morning tea time. A great experience begins with one swing. Managing finances with First Bank Richmond is just as effortless. Drive after drive, hole after hole, my game is on course. First Bank Richmond, this is where I belong.
SmartHub is a web and mobile app that allows you to do business with us like never before. You can manage your account, view and pay your bill, monitor your uses 24/7, report outages, and receive important notices, all in the palm of your hand. You will be able to save time and money with features like paperless billing, autopay, and much more. For more details on SmartHub, visit us online. Presented by Richmond Power and Light, your locally owned electric utility, building Richmond a better tomorrow.
I vote because I want my future generations to have a wonderful life like I do. I vote because I'm going to make a difference in my county and my country.
Just as like a rite of passage and being able to just show the community like, hey, I can vote, you should vote too.
I want to see a better life for my family, and the only way to see a better life for my family is to make change.
Let's shine by seeing the best in all of us and by looking out for everyone's well-being. Let's shine by staying true to ourselves while surging toward the future. Let's shine with the best care possible and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Welcome back to In Focus on WGTV Channel 11. Appreciate the support of our sponsors for this program. They have been sponsors for Whitewater Community Television in various ways for a number of years. First Bank Richmond, Reed Health, and the Leland Legacy. Always appreciate their support. We're having a chance to speak with Dan Burk, Director of the Wayne County Health Department. If you tuned in because you were expecting this to be an In Focus candidate forum, the candidates who were invited to participate in tonight's In Focus candidate forum could not make it as last week, so we have found another conversation to have. Next week we will be back with our final In Focus candidate forum, where we will be speaking with a candidate or candidates running for a 6th congressional district. Our current Congressman Greg Pence has decided not to run, so we will have a new representative, so you can find out what they're thinking in terms of the national office by tuning in next week. That will be a live program beginning at 6 p.m. and you'll be able to send your questions in through our Facebook page, as we will be streaming that again live on Facebook. But Dan, thank you very much for being here. Appreciate it. Finding out a lot about the health department. And health departments, when you go from state to state, don't all necessarily do the same things. So they're mandated definitely a bit more locally. So finding out what the priorities of our local health department are really are important. I know one of the things that has been a topic of conversation in the health department over the past couple of years are wells and septic systems. I did not realize until we were talking just before we went on that even some of the financial institutions are requiring some well testing when people are refinancing. I figured it happened when people bought a property, didn't always realize that it happened when they refinanced. Talk about how the health department is getting into that well. And it has been a conversation for a while, and there's been some back and forth and some pushback. Where have you all come down with this?
Okay, so just to go back on the first part of that, health departments are different county to county, not only state to state.
Okay.
So what we offer here, Randolph County or Union or Fayette may not offer. It's all based off of funding and staffing and stuff. There are statutory things, and some of those we covered, but a lot of our things that we offer are on top of the statutory things. So one of those that we just recently created is well water testing. So a couple years ago, there was an ordinance introduced, and that ordinance was going to test well water after the installation or repair of a well. And that required some things for the well driller to do in addition to what they do for the Department of Natural Resources. In Indiana, the Department of Natural Resources regulates all wells. They regulate the installation and the repair and things like that. The health department does not. There's a misconception that we regulate wells and we do not. That goes back to each county can do things different. So another county may have an ordinance where they regulate wells, but we do not. So after consideration and going, having conversations with our local elected officials and stuff, the well ordinance was ended up being declined. So we started to move a different direction. I receive several calls a year from realtors or homeowners and asking us if we would test their well water. And that's not a service that we offered. And I'd ask them, can't your home inspector or well driller? And they tell me that the well drillers would typically only do it during installation or repair, and the home inspectors would typically only do it during a full home inspection. So I thought, why not us? We're a public service. We do charge an admin fee for that, but it's very small, and then the lab charges their fees for the testing itself. But starting on October 28th, we will take appointments to test private well water, and that fills a void in our community for people refinancing or purchasing new homes. A lot of financial institutions are requiring third-party testing and third-party results, and they don't allow the homeowner to take those tests themselves. So we've created the program, and the health board approved it, and the county commissioners both approved it. And I have 2 staff members that will be conducting these tests, and we'll start off slow. We're going to start off 1 or 2 days a week, and to speed things up, that inspector will, first of all, the consumer will call in, schedule the appointment, pay the admin fee, and then at that point, our inspector will reach out to them and schedule the appointment as far as date and time goes. And then once we meet up with the homeowner, we will take the test and we will take it directly to the lab in Muncie. Typically, the courier from Muncie only picks up on Fridays, so that it's very limited and tests are week to week. So if we do it on a Monday, we can fill that gap in the middle of in the week. And once we get the results will come to us. That way it's transparent through the financial institution that it's not in the homeowner's name. It shows that we took the test.
Okay.
Our names will be attached to it, so they can always follow up by calling us or emailing us. And then once we get those results, we'll send them to the property owner, and then the property owner will supply them to the financial institution, unless they want us to supply it to the financial institution. If the test comes back negative, great. They can move on with their financial institution and complete whatever they were doing. If it comes back positive, then we will only educate on how to resolve that particular issue. We will not use any enforcement action whatsoever. That is not the goal of this program. It is to fill that void in the community. So it's, again, we'll test, and if it's positive, we'll educate. If not, they can move on with their transaction.
Talk a little bit about, I don't live on a well, but talk about some of the things that these tests are looking for, that the financial institutions are concerned about, that maybe even the homeowners are concerned about.
So, and this is just not for financial institutions. If a homeowner just wants their water tested, we'll come out and do it. It's just not for that. But most of the financial institutions are looking for bacteria. They want to make sure that the well is not cracked or any of the casing's not cracked, that the bladder tank in the basement or the crawl space or the garage, wherever that's at, that it's in good condition. But they will also ask sometimes for nitrates or heavy metals and things of that nature, and we can test for all those things. But typically it's just bacteria, E. coli and coliform.
Okay. You've been in this position as director. I know we went through very early on how long you've been around, but you've been director officially for how long?
Man, I think it was September 9th maybe when they voted me in, I believe.
Like this past September?
This past September,
okay.
yeah.
So still pretty, even though you've been around, still pretty new to kind of the lead up.
Yeah.
But you've had a chance, I think, in your role to think about what the health department does. And you just mentioned it's not even state to state, it's county to county.
Right.
So what this health department does, those around us may or may not do. You've been with the health department for a while. Talk a little bit about, in kind of your strategic planning, maybe what you want this department to do. What are some of your priorities? The board is going to be, the council is going to be approving the budget here over the next few days. Come January 1, you'll have a fresh new budget. You're running the department. Where does our health department go?
Well, I want to make longevity a key. So I want my employees to stick around. So that's the first thing.
Is that a difficult thing to get it these days?
It is. It's hard to get applicants. I had 3 positions open and I only had 4 applicants. And I believe we're one of the higher paid agencies, for those particular positions. So I want longevity. And the county council is also working towards that, and we really appreciate them taking that leap of faith with us. But once I get longevity, then I can start creating policies and procedures. That's something we lack of there at the health department. I've created several for the environmental side already and had those approved for both boards, and now my focus is going to the clinical side, and that is everything from receipting money to immunizing to charting to everything. There should be a procedure for everything. That way there's a holy grail. For some reason we do lose an employee, we have something to train the new employee with. So that's the next step, is to create policies and procedures, which in a sense will create longevity if people are comfortable and confident in what they're doing, if they have something that backs them up. And then once I get that accomplished, I would like to start a couple programs within the health department on top of what we're doing. One of them I was already able to do with the well water testing. But something else we lack in the community is places for people to do pre-employment drug screening. There's only a few agencies out there that do that, and Department of Transportation physicals. There's a lot of drivers out there that have to scramble and wait long periods of time before they can get a physical to renew their license. So there's a few things I'd like to do.
Okay. In terms of the health of the community, and we've talked about it a little bit, in terms of education, are there any particular programs that you think need to be started, things that maybe need to be beefed up from grant monies or things of that nature that the community really needs to know about? We talked about diabetes being one of those areas, high blood pressure being one of those areas. Are there things that you're hoping to be able to build in terms of helping just educate the community so maybe we make some better choices?
Yes. So we're already in the process of that. With that Health First Indiana money, with those partnerships, that's what those partnerships were for, was to primarily educate and promote those type of things throughout the community. And it's already started to work. One of them is linkage to care. So people that don't have primary care physicians or know where to go or where they can go. That's a lot of these events that we're holding out in the public. We are referring them to other agencies, or agencies are referring them to us, and that we're linking them to the care within the community. So those programs are in place, and they are focusing on everything from obesity to high blood pressure to linkage to care. We've enlisted the help of a company called Aspen, which is a navigating service, so they will help us navigate people to insurance companies, whether it's Marketplace or Medicaid. We plan on doing a marketing campaign before long to help and provide links and education links or flyers or social media posts. Education is the key to anything. You can try to sit there and preach to somebody, but it doesn't work. You need to educate them, and once they realize that, the way I look at it is when I was a kid, smoking was okay.
Sure.
As I grew, the campaign for smoking grew and grew and grew. And now we look at, if we compared the rates to when I was a child and a teenage child now, it's completely different as far as the smoking rate among teenage kids. And I think that's what we have to do as well with all the other programs.
There's things like smoking, diabetes, big conversation obviously needed about mental health. It has ramped up since COVID. Are there things that the health department does that can help people in that space?
Yes. So without going into great detail, because we're still working on a partnership with another company here in Wayne County.
Okay, I'm jumping the gun. Okay.
But that whole program would focus on mental health, and that will be one of our larger partnerships. So, and until that gets going, we do refer a lot of people to different, whether it's Meridian or Centerstone or primary care physicians and stuff. So, but yes, that will be a large focus of ours. We met with Lieutenant Governor last week or a couple weeks ago at Neighborhood Health Center, and that covered mental health. And we're going to largely promote the 998 crisis hotline to people. I've got it on our rolling marquee outside. We've got it on the social media pages, but the partnership that we're in works with will be a large program. So.
The other thing that I have heard, and maybe it's not a big a problem, you don't always know till you hear STDs in our community tend to be an issue. Talk about where the health department is in that particular space for people. And I've heard it's a growing problem even with older Americans.
Yes, we're pretty high in Wayne County for sexually transmitted diseases and hepatitis and HIV and all of them. So that is part of the outreach program that I spoke about. Not only is it's geared towards vaccines, but the outreach program, it's what we go to Ball State for. We test all those students for that. We had a partnership with Fayette County and Union County. We do a lot there at the health department. Anytime we have syringe exchange, we try to encourage testing with those participants. It's a large part of the health department. Right now, unfortunately, we don't have, without a nurse practitioner or a physician assistant, we don't have anybody to prescribe the order or prescribe the medication. So right now, until we get that position filled, we have to refer out for that testing. We run a program called 340B, and that is completely focused on hepatitis. So that is one of our large programs that we run and operate too, and that is testing jail facilities, whether it's here in Wayne County or it could be a different county. those populations tend to be high in the positivity rate for hepatitis. So we have the ability to test and treat once we get that position filled for all of those diseases.
And you mentioned it very briefly, just kind of in passing. It has been a point of contention back and forth in this community, the syringe exchange. Where is the health department in that space at this time? And as the new director, do you feel that it's the proper space for the health department to be in, I guess is the question.
I'm not educated enough on that particular program right now to have an opinion on it. Does it work or does it not work? It's hard to tell. The numbers are so old when you ask for them. So hepatitis was the reason it was originally started. The only way a syringe exchange program can be operated per statute is if an emergency declaration is declared, and that is reviewed yearly by the commissioners. The commissioners are the ones that declare it. The participation level has decreased quite a bit in Wayne County. So to tell whether it's helping or not helping at this point, I really don't know how to give a 100% answer on that, because the numbers are old, and those numbers can be skewed by everything from participation rates to different drug uses to several different things. So I believe my position on it is I will present the facts to the commissioners, and I will let them make that decision on whether they want to continue the program or not.
Sounds good. We're down to our last few minutes here. I want to kind of give you the floor. I know we've gone back and forth on a number of things, but there may be one or two areas that you really want the community to know about or re-highlight. So I'm going to let you go for a little bit.
Okay. Well, I don't have much. I just want the community to know that we're here to help and educate, and if we're not able to do it, we'll make sure we refer you to the right place, or we'll find the right answer for you. That goes from the clinical side, the environmental side, or the vital records side of it. We've gained a bad reputation, not just us, but every health department probably across the United States during COVID, with all the restrictions and things like that. So we're trying to break out of that cloud and reintegrate ourselves into the community in a better light. And I just wanted to know that we're here, and my mug and my email, my phone number, everything's on the website. If they want to contact me, they're more than welcome to contact me, and I will either have an in-person meeting with them or a conversation or whatever they want to have.
They can hit you all up on the website. You
Yes.
mentioned education. There's a lot of things I know because I check it out, and we share some of them that you all put on your Facebook page. Talk about how you all are using social media and what people can learn from that.
So we advertise most of our clinics on our social media. That's the Hagerstown Clinic, the Cambridge City Clinic, our Monday night late clinics, which we hold every week, and then the first Saturday of the month clinic that we hold. We advertise that on Facebook. If there is a delay, let's say the RV is broke down or the trustee's not able to let us in that day or whatever, that's how we update the hours or cancellations or rescheduling is through social media. Right now I have one of my environmentalists doing that duty as far as the social media part. Once my Deputy Director of Clinical Services starts next week and she gets acclimated to the position, I most likely will have her take over that position. I think she worked for a downtown agency doing some marketing and things like that, so I think she'll be better suited for that than what my environmentalist is. So yeah, we use social media as much as we can with what we have, basically. So we don't have anybody trained in the marketing department. So.
Real quickly, we've got about 3 minutes left, but what can people do with your app, and where can they get it? Is that still working?
So we have an Athena app, as you see here on the screen, and that you select the QR code and you can register or schedule your appointments for any clinical services that we have. Then that is up to date at all times. And it's out there on social media. I mean, it's pretty much everywhere at this point. Gennaro Sparks is our outreach coordinator. He's the one that created that and got it sent out to everybody. So, and our website domain has somewhat changed. It's waynecountyhealth.in.gov now. You don't have to go through the co.wayne.in.us.
waynecountyhealth.in.gov.
Correct.
Okay. All right. We'll make sure we get that correct. Right. Dan Burk, Director of the Wayne County Health Department.
All right.
Appreciate the time.
All right. Thanks for having me.
Do want to remind you once again, this was supposed to be an In Focus candidate forum. We will have another one next week. That forum is going to be feature representatives or candidates running for United States Representative District 6. Voting has already begun. I know a number of people have already gone and done that. You can too. In-person absentee voting, sometimes called early voting, voter registration office, 301 East Main Street. Don't forget to take your government-issued photo ID. That runs through November 1st, 8:30 to 5 on Mondays, Tuesday through Friday, 8:30 to 4:30. Then on Monday, November 4th, 8:30 to noon, that's the day before Election Day. 2 Saturdays, October 26th and November 2nd, 9 a.m. to 4 p.m. Then the vote centers will open on October 28th. They'll be open the 28th through November 1st, 10 a.m. to 7 p.m. First Bank Coleman Center, Go Lay Center in Cambridge City, First English Lutheran Church, and Hagerstown New Testament Church. That will also be open 2 Saturdays from 10 till 3. Saturday, October 26th and Saturday, November 2nd. Then, of course, there is Election Day, 6 a.m. to 6 p.m. The 4 places that we previously mentioned, plus Mount Olive Baptist Church, Life Spring North Church, First Baptist Church, and Centerville Christian Church Family Center. And then join us, WCTV, along again with our partners, the Western Wayne News, Wayne County Area Chamber of Commerce, as we bring you election night coverage beginning Tuesday, November 5th at 6 p.m. We will be live from the lobby of Whitewater Hall on the IU East Campus. Heading into spooky season, a couple of things real quick. Centerville Public Library cordially invites you to their night of mystery, murder, mayhem, and a whole lot more fun. Murder Mystery Party, the 24th from 5:30 to 7:30. There is the Harvest Fall Festival for the Richmond Farmers Market, which will be moving indoors soon, but still Saturday the 26th, 9 a.m. to noon at Jack Elstro Park. There's a sensory-friendly trick-or-treat in the park also on the 26th from 4 to 5. That's in Glen Miller Park for children ages 12 and under. And then RCT is doing the Woman in Black November 31st. That weekend, and then the weekend of November 3rd, tickets on sale. Go rct.org for more information. Thank you again to Dan Burk for being with us. Join us next week for another In Focus Candidate Forum. In the meantime, thanks a lot for watching this particular program. We always appreciate it. And as always, I wish you well.